Hello everybody, Dr. Dennis Ciccone here from Ciccone Family Chiropractic and Wellness Center. I wanted to talk to you a little bit about adrenal fatigue. This is something that comes up a lot in my practice, especially on new patient visits when patients are looking for help and trying to figure out what the root cause is, what is going on with their overall health. A couple of things I want you to think about with adrenal fatigue. Usually you'll be very tired. Usually you'll have difficulty with sleeping, either falling asleep, staying asleep, or waking rested. Lots of times when the adrenals are stressed, your cortisol levels will be high, so it's difficult to lose weight, especially belly fat. And these are just some of the things you can start to see. Some patients are also what we would call wired. So they're almost like in a stress or an anxiety standpoint, like there's a crisis going on inside their body, and that's what it feels like, but they don't actually understand what's going on. So let's just talk about a couple things, and I'll make it quick, but I'll give you some good ideas of things to look for with adrenal fatigue and get a better understanding of this. So the best way I think about it is I think about it like grabbing a rat's tail. The first thing the rat's going to do is what? It's going to start to fight. It's going to start to struggle, and that's what it's going to do until eventually it gets too tired to start to fight, and then it's just going to lay there and it's not going to fight anymore. Even to the point sometimes that you could let go of the tail and the rat just doesn't even try to give a fight anymore or try to get away because it's tried so hard, it's completely exhausted. That's what I want you to think about from an adrenal fatigue standpoint, and that's what I want you to think about from a stress response. So it's this emotional stress that causes these things to happen inside of your body. Now, most of us are familiar with the fight or flight response, right? So it means if something's coming to attack you or there's a stress, you're either going to fight it and win, and that's going to be over, or you're going to run, and if you outrun it, you will also win. But think about both of those scenarios. Both of those scenarios have an end, right? You're either going to win the fight or be eaten, or you're going to outrun the thing chasing you, or you're going to be eaten. That's the scenario I want you to think about with a fight or flight response. However, in today's world, what are the stressors? There's stress with our children, our boss at work, our spouse, our friends, all kinds of other things, right? Finances. These things don't go away like they're supposed to when you think about a fight or flight response. The other thing I want you to think about is in a fight or flight response, there's an opposite response that occurs. So that individual we just talked about that's running from something or fighting something, they're in a fight or flight response. But once that's over, they're in what we call the rest and digest phase. So I want you to think about that. If you're in constant stress all the time, you're in this fight or flight response. You're also not in your rest and digest response. So think about the symptoms that can start to happen. You can start to have low stomach acid, reflux, inflammation in the gut, bloating, because again, your body is not digesting food properly because it's in this constant fight or flight response. Remember too, we talk about this a lot in some of the other videos and in the webinars, is one of the main jobs of stomach acid is to break down your food so that you're able to break it down as well as disinfect that food. So if you're constantly in fight or flight response, not only are you now in adrenal fatigue, and that's stressed out like the mouse that we didn't let go of the tail, but now most likely there's infections coming into the gut, and there's other things that are stressing the immune system, causing reflux, and these other issues. So these are normal symptoms that you'll see when you start to look at the stress response and being under a significant amount of stress all the time. So that's what I want you to think about with adrenal fatigue. I want you to think about it's a response that's occurring, and your job is just to identify when you're in that stress response and try to minimize it as much as possible. Sometimes it's going for a walk. Sometimes it's reading a Bible, meditating, a shower. There's a lot of different things you can do, but you want to identify what that stressor is and start to work towards removing it. The other tip that I can give you to start working on is you also want to think about what that stressor is. Lots of us, we have a constant dialogue that we run through our head. And usually it's not very positive, and it's usually pretty stressful, whether it's worrying about our kids or our family or not being kind to ourselves, things we would never say to anybody else that we really cared about, but we say it to ourselves. Some of you are laughing right now because you know that I'm talking to you. And when you think about these things, I want you to start to identify what they are and start to remove what that statement is. There's some neuro-linguistic type stuff that we work on through the program where I will give you tips and tricks to work on this more effectively, but you have to identify what these thoughts are and start to remove them so that you can start getting a healthier response and decreasing this fight or flight or adrenal fatigue response that you're having in the body. The other side of this that is so important is not only do you need to stop making it, but again, remember, you have to heal the damage that it's caused up to this point. That's where me and my team can come in. We can do testing. We can see how much the damage is, and then we can work on repairing that so this comes back. Remember, just removing the trigger doesn't fix the problem. That's why so many times people will even maybe get a good response when they remove it, but as soon as the stress comes back, it comes back full blown. That's not the way it's supposed to be. If it's healed, you should be able to manage more and more stress and be less and less affected by it. So if you're feeling like that rat that is either done fighting or you're continuing to fight and you're looking for help, reach out to us. We'd be excited to help you get through that and work through some of that adrenal fatigue. And look forward to talking soon. Have a wonderful day.